Curtis. I'm going to be doing a presentation on HPV prevention and awareness. Like I said, my name is Lisa Curtis. I'm a registered dental hygienist. I currently attend Northern Arizona University, and I'm working closely with NAU to spread awareness about the human papillomavirus and prevention methods. We thank you again for allowing us this time to come into your office and spread our message. All right. So first we're going to take a pre-test. Test your knowledge about HPV and prevention. Alrighty, so now that we've taken the pre-test, let's get on with the presentation. HPV equals sexually transmitted cancer. The HPV is a virus that causes skin and mucous membrane infections. It is passed from one person to another by skin-to-skin contact, and that's also including sexual contact. The human papillomavirus can be connected to several forms of cancer, including cervical cancer, vaginal cancer, penile, oropharyngeal, anal, and rectal cancers. According to the Oral Cancer Foundation, HPV is the #1 sexually transmitted virus in the United States. And being in the dental field and knowing what to look for is imperative when detecting HPV. Examining the head and neck for HPV lesions means we will typically see the strain of 16 and 18 HPV. Okay, this is a little diagram. As you can see, so red means it's HPV related, and then blue is non-HPV related. So if you can see, cervical cancer is almost all HPV related. So all these cases could have been, they could not have happened if they would have had the vaccine. So anal is also pretty high up there. It's mainly HPV. Vaginal is about half, penile is about the same, and oropharyngeal is about 70% is HPV related. Now, I just gathered a couple facts about HPV, some things that kind of shocked me a little bit. But during 2008 to 2012, an average of 38,793 HPV-associated cancers were diagnosed annually, including 23,000 among females and 15,793 among males. The most common of these cancers were 11,771 cervical carcinomas and 15,738 oropharyngeal squamous cell carcinomas. One that really shocks me, of course, the cervical cancer, that's really high, but if you can see the males, there are about 12,638 cases of oral cancer compared to females, which is about 3,100. So males have a lot higher tendency of getting oral cancer than females. Some types of HPV can cause oropharynx cancer, and other types of non-cancer causing oral HPV can cause just warts in the mouth or throat. HPV-related oral cancer can be deadly, especially found on the floor of the mouth. Cancerous lesion found there has the lowest survival rate after 5 years when diagnosed with stage 4 cancer. And if anybody knows, I'm sure all of us in the oral profession know that the floor of the mouth is very vascular. It's got a lot of blood flow down there, so if cancer starts there, it spreads a lot faster. HPV-related cervical cancer accounts for over 90% of cases in the U.S., so that's literally almost all the cases of cervical cancer are HPV-related. HPV awareness. Healthcare providers are first in line of defense against oral cancer. Routine oral cancer screening is on all patients by the hygienist and the dentist. Can help to identify abnormal lesions or cellular dysplasia. The tongue is the most common location to find oral cancer. So, as you can see, that's a lesion. I've actually seen one that looks exactly like this. HPV lesions can vary from white to pink, and the surface has been described as having a cauliflower-like texture or finger-like projections. Symptoms are typically painless, and the lesions should be referred out for excision and biopsy. However, surgical removal does not mean the virus is gone. It will more than likely come back in elderly or immunocompromised individuals. Here we've got some cancer screenings in the background. This is kind of what we do in the chair, the dentist and the hygienist. Both extraoral and intraoral landmarks should be examined during a cancer screening. Lymph nodes in the head and neck should be palpated thoroughly for abnormalities because cancer spreads there first in later stages of oral cancer. Cancer screenings help detect the most common symptoms of oral cancer, which is a sore in the mouth that does not heal. So it looks similar to an ulcer patient. They say that if it's past about 21 days, that's when you should be a little more concerned about it if it's been there for over 21 days. Preventative measures such as vaccination and education about the human papillomavirus is imperative for the health of the community. All right. So, just another couple facts here. This is the risk factors for oral cancer. Risk factors for oral cancer include tobacco use, alcohol consumption, HPV exposure, and being a man. So, men account for over 75% of oral cancer cases. I don't know if you guys can really see this, but I got a little diagram here. It says vapor, smoking, and smokeless tobacco is one, so even vaping is bad. Alcohol use, so it's about 15 plus drinks for a man and about 7 plus drinks for a woman a week. And that increases your chances of getting oral cancer. And then if you're exposed to HPV, that increases the risk even more so. And if you're smoking and drinking, then you're double time here. So, and then I got this little diagram here too. A lot of these little facts, I mean, were kind of a little heartbreaking, honestly. 8,000 deaths due to late stage diagnosis, and 63 of oral cancers are found in the late stages. So if we more on top of it, educating our patients, making sure we're doing the oral cancer screenings, at least we can make sure that our patients are safe and healthy and they don't have to ever worry about that. Alrighty, so I got a little video for us here. Oh, this is where it's going to get a little crazy. Double click. That's fine.
Teens and vaccines. Preventing HPV. Vaccines are commonly associated with babies and young children, but tweens and teens need vaccines too. Vaccines can protect them against tetanus, meningitis, flu, and HPV. HPV is short for human papillomavirus. HPV is passed from person to person during skin-to-skin sexual contact. HPV is a common virus. In fact, almost everyone will be infected at some point in their lives if they are not vaccinated. Most people naturally clear the virus, but not everyone. If you don't, HPV can cause cancer of the cervix or vagina in women, cancer of the penis in men, and cancer of the throat and anus in men and women. In fact, 4,000 women die each year in the U.S. from cervical cancer, and there are more throat cancers associated with HPV than tobacco. Most of these deaths can be prevented by vaccinating your kids, typically around 11 to 12 years of age when other teen vaccines are given. The HPV vaccine is not new. It has been proven safe and effective by many years of medical research, and over 40 million doses given. The HPV vaccine is very effective. 99% of the girls and boys who are vaccinated will get protective antibodies against the HPV virus. Side effects are mild, like soreness in the arm. Doctors and nurses are well trained to administer the vaccine and diagnose any minor side effects. If you have any questions about the vaccine, ask your doctor. They are experts and will give you all the facts and the best medical guidance for your children. HPV vaccination is simple, just 3 easy shots, and your children will be protected. Don't wait. Protect your kids against HPV and related cancers. Talk to your doctors today. HPV vaccine. It works. It's safe. It saves lives. This message has been brought to you by the American Academy of Pediatrics, New York State, Chapter 1.
All right. Let's get back to my
Got it.
IT guy.
Thank you.
Perfect. Okay, so from the video, it says that, you know, most patients or people will get HPV infection, that it clears. Most of these people, it clears. But for some individuals, it will stay, and then it can cause cancer later in life. So about 50% of new genital HPV infections occur in the 15 to 24-year-old age range. While your child may be at risk now, the risk for getting HPV increases as they get older. That's why it's important to learn how you can protect your child from HPV sooner rather than later. Now, on the video it says 11 to 12, but I've seen in other researches and other information about HPV that even as young as 9. You can even get them vaccinated as young as 9. So the earlier the better. Obviously, even if, let's say, your patient has already been sexually active, and can they still get the HPV vaccine? They still can get the HPV vaccine. Now, it's not going to be as effective, but as long as they've had the HPV and they haven't gotten cancer, obviously, then it can help them from not getting cancer later in life, as long as it's been 1 year since they've had the vaccine. So, I mean, obviously, the younger the better. We want to get them before they're sexually active, but if that's not the case, we can still, protect them as best as we can, getting the HPV vaccine later. Now, it's very important that you get all 3 vaccines. If you only get 1 or if you only get 2, it does not work. You need to get all 3 for it to be effective.
What's the spacing in between?
I think it's about, I want to say about a month. I got mine like literally right when it first came out, and I got all 3, and I want to say it took me the whole summer. So it was like the whole summer, and I did it in the beginning of the summer, the middle of the summer, and the end of the summer. So about 3 months, I'd say. Now, healthcare providers need to use resources available to them, such as the human papillomavirus screenings, as well encouraging vaccinations in 9 to 12-year-old population. The HPV vaccines such as Gardasil 9, Gardasil, and Cervarix decreases the chances of developing HPV-related cancer. And I've been doing my research, and there was one study that kind of popped out at me the most. And it was called Perception, Awareness, and Acceptance of HPV Disease and Vaccine Among Parents and Boys aged 9 to 18. And the researchers were Tina Tan and Melvin Gerby, and they surveyed about 230 private pediatric office parents and 286 public health clinic parents. And out of all the survey, there was no difference between their knowledge of HPV and the barriers between HPV and the vaccine. And that was, with significant differences in education level, socioeconomic status, and even having HPV disease. So they said the #1 thing that held them from not wanting to get the HPV vaccine was lack of information of HPV disease and the vaccine. So all these people need is just somebody to tell them and explain to them the importance of the vaccine, what it can do, what it can ultimately save these children's lives. So it's our job, everybody here, to make sure that the patient is aware of what's going on, and if they have questions, help them with the questions. And the more education these parents have, hopefully we'll have a healthier community with less cases of HPV-related cancer. So, let's see. If anyone has any questions about anything, this is the time to ask. If you don't, we're just going to take the post-test again. Yes?
So with that research with TAN, did they actually talk about how effective each of those brand name ones is? Because those are just brands, right?
Yeah, I mean they're all exactly the same, just a different name. There's the name brand one, and then there's the generic one, but they all have the same active ingredients in them.